Really, the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Hello.
Hello.
Dr. Natalie Keith.
Dr. Josiah Dame.
And this is Vet Tales.
Yes.
We're going to talk about blood work today and then see where that rabbit hole leads.
Yeah, we're literally saying we'll talk.
Yeah. Well, let's talk about blood work. We'll see where it goes from there.
It'll go somewhere.
It'll go somewhere. It will. We decided.
It definitely.
I kind of was thinking it may even be like a part 1, part 2. But let's start with CBCs.
Yes.
Okay. Complete blood count.
Yeah. I was like, please say what this. This is my brain just went completely blank.
Yeah. Yeah.
Complete blood.
Complete blood count, which is interesting to think about because I guess it is actually counting the blood cells themselves as opposed to the enzymes or proteins or other things that we find in our chemistry analysis.
Yeah.
So white blood cells, red blood cells, platelets.
Yep. The 3.
Yeah. And then those all have little subcategories.
Yep. And I usually tell people what I'm checking for is how many red blood cells you have floating around and how many infection fibers you have floating around because that's usually what.
Yeah. And the clotting.
And the clotting, of course.
The clotting guys, which are the platelets. Yeah. So your red blood cells, do we have enough of them? Are they too concentrated from like dehydration or something like that? Are we anemic because there's not enough of them? If we are, why? Are we anemic? And are we trying to make new baby red blood cells or not? Or are the red blood cells we have, do they look really old and pale? Platelets, if they're low, those are your first line of defense when you get cut.
Why are they low?
Yeah, why are they low?
You usually go, is that real?
Is that real? Because it's like a super common lab error, if you will.
Because the way that you poke the vessel, you can even cause them to like clot in the tube sometimes. So if they're low, we always go, let's make a smear and we'll
look for clumps. Yeah. Because it will, I mean, their job is as soon as there's some kind of puncture is to start globbing together and making a little concrete barrier. It's just like this giant like Red Rover game. They all grab onto each other and try to like stop the flow of blood out the hole. Did you get a visual?
I did.
Anyway, so they sometimes will get clumped just in the process of drawing the blood. And so it doesn't necessarily mean your patient's platelets are low. It just means there's less floating in the blood actively because they already went to work.
Or sometimes there's breeds that have giant platelets and you have to know that there's one particular breed.
Is it the Basenji?
It's the King Charles Cavalier.
What?
They have the mega platelets.
Lol. Somewhere a file door just freaked out from the back of the brain.
King Charles Cavalier, like if they come back with platelets, I immediately go, and I'm like, was that stick good? Because that's immediately I ask the text, how is the stick? Why are the platelets low? I'll be like, make a smear. But if it's King Charles, I'm like, okay, they're probably big. So they're counting them as a different cell usually.
Yeah, just misnaming them in the machine.
Usually counting them as a red blood cell.
Yeah, like a baby, yeah.
So red blood cells, platelets are on the CDC, and then white blood cells, which is this huge umbrella term.
Yeah. Infection fighters, as you say.
Can we name them all?
Yeah, let's do it. Neutrophils. You go.
Oh, gosh. Lymphocytes.
Eosinophils.
Basophils.
Oh, man, there's one more, isn't there? Monocytes? Okay. I was like, what one did we not say yet?
Lemon.
I had no idea.
Buckle up. If there's one thing I'm good at, it's taking tests. And I've had names for everything. Lemon, lymphocytes,
eosinophils, neutrophils.
We spelled lemon wrong.
Lymphocytes,
eosinophils, monocytes.
Wait, what's the O?
Oh my God.
I'm so confused.
You throw away the O.
Oh, okay. And then neutrophils. That makes sense. What about basophils?
Who cares? Okay, guys, cut to discussing what white blood cells are important. That what we're looking at most of the time. Yeah. Let's list them at the same time in our at the order we look at them.
Okay, ready? 1, 2,
1, 2, 3.
Neutrophils.
Second,
lymphocytes. We're so good at this.
Third, eosinophils.
Oh yes, absolutely.
Monocytes.
Then basophils. Yeah.
It's the reason why
I hold
lemon in my head is because I think Richie taught us it. maybe Dr. Ritchie, the legend.
Yes, the man, the myth, the legend.
Myth, the legend at Oklahoma State University.
Yeah.
Shout out. I think he taught us it. It might have been somebody else in the path lab, but you write down lemon, who needs the L, just put it in. Put an arrow down for the first two, an arrow up for the last two to meet the middle, then that's a stress response. In CBCs, you can have an elevation of certain things and a decrease of certain things just from stress alone.
Yeah, that can happen pretty quickly.
Yeah, it can happen very quickly. So that's the first thing when we look at a CBC and we're looking at those neutrophils. Depending on how high they are, will depend on how much I care.
Yeah, absolutely.
About elevation. And so with lab work, people, like if I were to send every lab work home with a client, I would get a call from every client being like, that was red and you didn't tell me. Yes. Like there are things that can be low or can be high and it's not a concern because it's just
a normal variation
or something's contributed to that change.
Yeah.
Maybe that's our age that's contributing to that change, or maybe that is, so puppies will have some changes, or maybe it's, lemon.
Yeah, lemons, just,
stress.
Stress. Yeah. Yeah, a couple thousand up on neutrophils, which we read everything by the thousand. So if your normal is supposed to be 17.5 and you're 19.5, what we're really saying is 19.5 thousand or 19,500.
On the white.
On the white, yeah. Yeah, on the white blood cells. And so that is a number that we don't really get too worked up about if it's just a little bit high. But then if we my brain just went straight into like pre-sepsis, like degenerate neutrophils. So neutrophils. These are the most important ones. These are the frontline soldiers when there is a war outbreak somewhere in your system and they are deployed out. So they're floating around in the bloodstream, doing it like patrolling. And then there's like an issue somewhere and they all go immediately to this battle. And then the bone marrow goes, oh, all the neutrophils disappear. And so it starts kicking out new neutrophils. Well, the neutrophils that show up at the battle first, they start just taking a whooping and they become what we call degenerate or toxic neutrophils, meaning that they have obviously been to war. They are wounded soldiers. And then you have because they're all what we call originally mature neutrophils. So they were already meant to be out there. They're doing it. They've seen a few things. They've been out there doing it. But then whenever the bone marrow is like, we need more neutrophils, they send out what we call bands. And bands are like the kids who didn't get training yet.
Analogy got done.
It did.
Yes.
It did. But that's immature neutrophils. And they're not ready yet, but out they go.
Because you can have technically a normal number of neutrophils, but if your population is mainly bands, on the machine, I should say. If your population, then you look at the manual and you're seeing mainly bands, then you're like, oh, there's a left shift is what we call that.
Yeah. So left shift means you have way more bands or baby neutrophils than you have mature neutrophils. And you can tell them apart by looking at them microscopically. And some of our machines are actually capable of identifying them as well, which is nice. And then you can actually let's say, let's use a uterine infection because we just talked about pyometris not too long ago. Classic. Yep. They will shoot that neutrophil number up into so if a normal is like around 18, these dogs can get 40, 60, 80,000. But then if you go around too long, that number will start to drop back again. And you can actually get all the way down to normal, but be septic. Because you've sent out all the soldiers, all of the mature ones, all of the bands that are the newbies, and now even they are gone. And you can be getting down into low numbers of neutrophils, even be below reference range. And you think, oh, okay, well, that's normal. But it's not normal. This dog is septic. Yeah. And so that's a whole nother kind of crazy.
And then lymphocytes.
Those are great for chronic inflammation.
So chronic inflammation, certain chronic infections. So tick-borne illnesses are a kind of classic one. And then lymphomas.
Yeah, and cats leukemia.
Or lymphomas that then turn into.
Yeah.
And we'll see the changes in their blood.
Yeah. So we're really hoping that you guys, when you hear this episode, don't hear the dog barking that we hear, but the AI cleans that out. It's nuts. So if we sound distracted, it's because there's a dog that we can hear. Yeah, we can hear the dog. I hope you cannot.
If I could record my thoughts
Yeah.
and like play it out loud.
Yeah.
Or thoughts. Guys, like people out.
I mean,
just like all the conversations are.
Yes. I call them competing
They're all
thoughts.
my voice.
Yeah, just me.
It's just me, but
Processing the insides and the outsides, yes, for sure. So leukemia, like feeling leukemia cats, they'll have lymphocytes through the roof.
Yeah, lymphoma cats that over time, if it becomes stage 4, then you'll get that leukemia where your blood is then effective.
Yeah.
All those things. And that's the worst.
Yeah.
When you see those.
Yeah. That's a really bad situation to be in.
And of course, when you see that high number on the lymphocyte, you can make a smear and you're like, is that real?
Right.
And we look at it under a microscope
to confirm.
Confirmation.
And then you have your eosinophils that show up when you have primarily parasitic or allergic responses. So something that's invaded that's a foreign thing. Mm-hmm. So whether it be like, again, like an allergy, heartworms. Yeah.
Fleas will cause eosinophils to be time. Mm-hmm. And then basophils and monocytes.
Yeah. So monocytes are kind of the cleanup crew. Like when there's been a pretty big catastrophic event and somebody's got to come in like with the bulldozer to do some cleanup. I feel like that's what monocytes do. Basophils, I think, also are kind of like in that camp of the allergic reaction-y thing. Yeah.
So I'm assuming that's
something they talked about basophils. Yeah.
We talked about this, that we don't care too much of them.
Yeah.
And someone's going to write into us and say, care more.
Yeah, care more. And I'll be like, you know what? You give me someone write in and tell us why we care about basophils, and I'll put it back on my radar.
I think too far.
We could. But yes. I've been doing this a minute, and it hasn't really ever impacted any case I've ever been on. And they're like, oh yeah, did you see that basophil count? Nobody cares. they're like the middle child.
I've had one eosinophil where I've been like, why? It's the only thing that was ever elevated in this kitten.
And it was
and it was 5,000, and I could not figure this one out, and did a lot of testing to figure out, okay, do you have a parasite that's just hiding from me? So I did PCR testing on the fecal matter. I did like multiple times. I treated with a dewormer to like watch for a response. It was like a chronic, not good doer. Mm-hmm. Young kid that like just didn't grow.
Failure to thrive.
Kind of thrive, yeah. Ended up landing on like eosinophil granulation like disease.
Oh yeah,
but a diffuse version. Like
interesting.
That's called a lot.
Instead of like a granuloma, it was a diffuse systemic
issue.
Interesting.
And it did stress, of course.
Of course it did.
So
naturally. Yay, steroids.
Yeah.
So yeah, then the platelets, I think we talked about a little bit in terms of their function. We can see certain disease processes deplete those stores. I think primarily other things that have caused a primary bleed and used all the platelets up. And then, of course, you have like immune-mediated thrombocytopenia, where you have the immune system decides that the platelets actually are not wanted. Yeah, they just your immune system goes rogue and just starts attacking your own platelets. And then you don't have enough platelets. And then you have spontaneous bleeding, and it's terrible.
Terrible.
Yeah. It really, yeah. I mean, it's not the worst. The worst is when you have IMT and IMHA, which is where Evans syndrome, where they actually are, the immune system decides all the cells in your body are bad. The red ones and the platelets. I don't know if it actually affects the white ones or if the white ones.
Evans doesn't.
Yeah, I didn't think so.
But you can get immune-mediated like bone marrow. So a great way that I break down the CBC, like if something's changed, mainly in decreased numbers, break it down with you either used them, they were destroyed, or you're not making them.
Yep.
So you lose them, you destroy them, or you're not making them. So the destruction would be like the immune-mediateds. The use would be like your clotting or neutrophils, you're dumping them somewhere. And then if you're not making them, all of these things are made in the bone marrow.
Yeah, and that's always the hardest one.
Yes.
Because nobody wants to do a bone marrow biopsy.
No, definitely when you have no platelets or no red blood cells, no one wants to touch the bone marrow and affect an organ that has a lot of vasculature.
Yes.
It's not fun.
It's not.
And it usually turns out to be like, okay, like this is the last ditch. Like,
yes.
To find out what's
and then it's very difficult to treat those conditions too. I mean, I can't think of one actually that you're like, oh, thank goodness it's that. Now we can treat it. Like, like it's just bad. By the time you get down to bone marrow biopsy, like, you're in trouble. Unless the bone marrow biopsy comes back normal, and then you're like, okay, thank goodness it's something else that I haven't figured out yet. So that's always fun too.
Yeah.
Oh, yay, CBC.
So that's kind of CBC.
Yeah. I haven't done many bone marrow biopsies. Chronic anemia in cats.
Yeah.
If it's not renal disease related, it's pretty rare.
I've sent one to get a bone marrow aspirate, and then they didn't do it.
Okay.
So
that's so funny.
Specialist.
I was like,
she was looking at me and looking at me. Why do you look?
I know. I kept staring at him. I was like, he's poised to speak.
I did a full workup on a particular patient and everything, and I had it on a particular antibiotic that you'd use in a certain cases when your like bone marrow is not making the neutrophils anymore, and it was on it for a long period of time. And I referred out at that point, and I was like, I need you to get a bone marrow aspirate. It's not something that my clinic did. My previous clinic, this clinic, we can do bone marrow aspirate, so my previous clinic did not. And so I sent them out to go get one, and they sent it back and never did.
And they were like, no.
They're like, no, continue the antibiotic. And I was like, no. It was like, so because I wanted them to do it, because I knew that if we didn't do it, we were just going to continue to do the circle of just, okay, it's like waxing and waning constantly. It's already been on this particular antibiotic for quite a while. And they recommend the extension, not doing it. And it made me a little sad, which is why Natalie looked at me like, what?
I was like, what is he going to say? And I just, like, it maybe didn't feel like a very long pause to y'all, but between us, it felt like a very long pause.
I was reliving that. That was one of the few cases where I was like, I do want a bone marrow aspirate. And then I sent them to do it, and then it just...
And they're like, no.
Made me sad.
Yeah, because you're like, oh, I just need that
answer.
I need that information, yeah. Leukemias are super interesting on a CBC as well, in the sense that I've had a couple of old dogs actually get neutrophils as the leukemia cell that is being overproduced. So basically, leukemia is a bone marrow cancer where the bone marrow just starts going rogue and producing really poorly made cells in high volume, and then stops making other cells because it's so busy making the poor quality whatever cells. So most of the time it's lymphocytes. And we see that in cats with feline leukemia. But I've actually had some old dogs that it was neutrophils, which I thought it surprised me.
That's crazy.
Yeah, I thought it had like some nasty infection, like 80, 90,000 was the neutrophil count. And I was like, what is happening? So actually Dr. Ritchie, just to throw him back into an episode, the same one twice, I was like, what? I don't understand. I hadn't been out of school for very long. And he was like, yeah, that's leukemia. And I was like, I'm sorry, what? He's like, yep.
Yeah. I've never seen that. I've only seen lymphocytes be extremely high when I like.
Yeah, I had it happen one other time after that. And I was like, oop, I know what this is now. So it is, yeah, because they get concurrently anemic.
That stinks.
Yeah, it does.
Because the bone marrow gets overwhelmed, and they're just focused on making this one cell, and it's like...
Yeah, and antibiotics don't help because there's no infection. That is a false pathway. So anyway, a little food for thought. But
so that's a CBC.
Yeah, that's a CBC. It's 20 minutes in. What do you want to do? Do you want to tackle some chemistry stuff? Do you want to talk about coags before we get into chemistry?
Let's talk about coags, because we'll pair it to platelets, and then we'll break and then do the comp and the...
Part 2. Yeah. I like that plan.
So coags.
Coags. Oy.
Oy. Oy vey.
It's so bad. Yeah, we do run a lot of coags here.
It's just fun. This episode, you're just seeing in our brains.
Yeah, peek behind the curtain of... Yes.
There's a lot of use for lab work, but you can also get lost in the sauce.
And you have to interpret the whole patient too. Like, you can't just look at a number. Like, people are really, I think, confused when they think, well, you did blood work and you said, like, whatever, so we must not have cancer. I'm like, no.
That actually might make it more higher on my list if the lab works normal and your dog has continued.
Absolutely. So, that happened to me today, actually, with a lab, which I actually think has Addison's. So if you guys want to rewind to the Addison's episode, that disease is bear to contend with. But all this to be said, coags. Coags, we are talking about coagulation. It's mostly we're talking about the clotting cascade. And there's all of these factors within it. And it gets impacted. One of the most common things that we think of is rodenticides. But that's not the only thing. We have DIC.
Which means disseminated intravascular coagulation, which just means the body is coagulating within the vessel itself without a true cause. It's a symptom of shock, and the name for it that people use.
Oh no! Yes,
death is coming.
Death is coming. Yeah,
or death incoming, but it starts to happen right before the patient starts to decompensate.
Yeah. Yes.
Use them. So we've had a couple cases here with DIC where it was a major, a GDV. The dog was going into DIC.
Which GDV means gastrodilation volvulus, which means their stomach torses, and it cuts off the caudal vena cava, which is a major blood vessel that's returning blood back to the heart, and that is bad news.
Very typical shock patient for sure. And, thinking we have plasma, which has some platelets in it, so we're able to help that one. But yeah, with the PT-PTT, I think the most common reason why we run it in clinic is for pre-surgical on some patients. And then, yes, for rodenticides.
Yep.
But.
Yes. Are you going to bring up the giant breeds?
No.
Oh, okay, good.
I was going to bring up. Rodenticides haven't changed.
Oh, yeah.
Bromethylene now, so we're not seeing the vitamin K one much anymore, which is.
Wait a minute. I thought bromethylene.
Bromethyline's the.
Which is the vitamin D? Because bromethylene still responds to vitamin K, doesn't it? It just takes 3 weeks, or am I saying that wrong? What's the other one?
I don't know the other one, but bromethyline's the Tomcat one now.
Yeah.
And that's the brain.
The neurotoxin, yeah.
So that one, there's no counteraction other than make them vomit and then watch for seizures.
Yeah.
But, not sadly.
Yeah, you just have to do rapid decontamination and yeah. Yeah. So,
yeah, you used to wrap with, of course, the vitamin K one, which vitamin K plays a role in
the clotting cascade. Yeah. So what's interesting about that is that when that toxin is in the system, it can actually interrupt the clotting cascade for up to 3 weeks. And so even though your dog looks normal and you've been on vitamin K for a week, you're tempted to be it's fine, but it's not. You have to continue for 30 days to make sure you far surpass any remaining interruption of the clotting cascade. Yeah, and if you have interruption of the clotting cascade, you're likely to also have low platelets because your platelets are going to try to step in and cover the gap, and they just really aren't equipped to do that.
And what the PT-PTT, which is the clotting coagulation panel, is telling us, do you have any disruptions of that clotting cascade? The clotting cascade is a big
12
thing.
12 things, factors, I think, right? 12 factors in the clotting cascade. Yeah.
I memorized it once.
I probably did twice. I definitely memorized it the exact same amount of times that I forgot it.
There's a lot of things that can affect that cascade, though. And the PT-PTT is just telling you it's okay.
Yeah.
Versus it's not okay.
Yeah.
So not having platelets can affect it. Obviously, there's disorders, genetic disorders like
von Willebrand
race factor.
And the Dobies.
The A and B.
Hemophilia.
A and B. Those can affect it, which are genetic disorders that you have to do genetic testing to find out if they actually have it. And then vitamin K issues with rat poison. So a lot of times we do it. Most commonly, we're going to be running it on large breed dogs before they go into procedures. I like to do it before any time we touch a liver in the surgery.
Yes.
I like to do a PT-PTT to make sure the coagulation factors are good before we take a liver biopsy or anything.
Because the liver biopsy is just hey, I really hope that you clot liver because you can't really ligate very well. And so you got to really make sure that that's on point. And then the giant breed dogs is what I was kind of alluding to a second ago. And they have a much higher risk of anesthesia-induced DIC. And one of the indicators that the dog is at an increased risk is having elevated PTTs. And so we'll actually pre-treat those dogs with vitamin K to hopefully offset the risk of that. And it typically is very successful in that. It's a lot.
It's when we were talking about earlier about how good the stick was, that test, if the stick is not perfect, the test is off.
Yeah.
So it's a it's a very particular test. It's very sensitive. And so you have to be very good at the blood draw. The blood draw has to be basically perfect. And then filling the tube, you want to be careful.
It has to be perfect. And running the test has to be perfect. And so that's why I just give vitamin K to all the giant breed dogs and call it a day.
All right. Part one.
Part one. Woo. That was a lot.
What?
Yeah. Chemistries, I think I actually like chemistries more.
I love chemistries.
Yeah. I'm the ClinPath nut, though.
I love chemistry.
Yeah, same.
I'm excited to talk about it.
Me too. I'm looking forward to it. We'll do that next time, which is next time Joe and I are together. Yeah, we can. I actually think that may work. We'll see. But that'll be the next one Joe and I do for sure. And then if I get Caitlin linked into another one, who knows what I'll get her going on about. But
I want to listen to vectors.
Oh, she's a funny girl. All right. Okay. Bye.